right. Good morning, everyone. Thank you for coming to class in this heat. And so today we're going to continue after the weekend on our fourth talk on quality. So yes, quality is a big topic because this is why the focus of why we're all here about, why we're doing health services research, why we're interested in studying the collection and processes, inputs, structure, and outcomes. It's mainly to answer a universal challenge, which, a question that no one really has cracked it yet, which is, what is a good quality service and how do we make our services, of good quality and better quality? Yeah, so this is what it's all about. It hasn't changed. What we're trying to do, wherever we are in the system, whether we are, at the level of the micro, meso, and macro, whether we are a purchaser, a provider, or a regulator, whatever player you are in the system, it's all about how do we run it? How should we run it? Should we use this system, that system? Why are there so many different ways of running the health service? What's it all about? We just want to have the best quality within the resources available. So high quality care at the least cost. Because we know there isn't never enough money, never enough resources. And also, if we have put more money in, we know that there's always more that can be done. We looked at the era of cost containment, the era of expansion, cost containment, and now the era of accountability. Because from experience, we've known that the more money we put in, the more ways there are to do different things. We have more demand, more expectations, more suppliers, more doctors offering services. So how do we qualify quality and give high quality care to our patients in the least cost? Good question. So you remember from the introduction, we talked about what high quality care should look like, and we talked about the different dimensions of quality. And first of all then, we will remember that a high quality service would provide care that is safe. So to do the sick no harm, Florence Nightingale said. And so you want to go into healthcare no worse than you come out, and that is really what one very important of a dimension of quality is safe. Okay. Afterwards, you remember that we want to make it effective, make it do some good. You want to come out better than how you got in. That would be universally quite accepted, that it should be effective. You come out feeling better, essentially. Then we have humanity. Humanity is, remember, quite hard to define, but essentially is treating people with respect and also in a timely way. So the WHO does classify it as responsiveness of a service, and there are different ways of explaining humanity. Some countries look at patient experience. Essentially is having the dignity that people should go into and receive a service and be reasonably treated, basically. How you want to be treated if you were the patient. And finally, equitable. Fair in a way that's based on clinical need rather than other characteristics, so social variables like age, like your sex, gender, etc. And so I think we can establish that if there are these four dimensions of quality, then it would really help us look at the service in a holistic way. So we must remember that efficiency, the ratio, is a ratio of the quality to cost, is not in the equation of quality, okay? Is not one of the dimensions. Because efficiency talks about cost is a kind of sort of economic way. Anything like productivity means that you put costs into your quality equation, and then you can't then balance quality with costs. So just to remember that, essentially, you can have a very high quality service that is not efficient. Now, policymakers don't want that, but you can have really high quality in the four dimensions we talked about: safe, effective, humane, equitable. Just that it's not in a way that you want to pay for, you want to be able to afford. So efficiency is something else. Okay. But really, what we are aiming to do is have care that's provided in a way that ensures the greatest benefit for the least costs. So this would be what we're up to doing. But it's a trade-off. We can't really have maximize all the dimensions of quality. So an example of how it's a trade-off is that we know that PCI centers and stroke units are good to more centralized services for these conditions. So if you put patients into a big center, it's very effective. So we've upped effectiveness. But then that means geographically, not everyone can have a hospital very close by. So you restrict equity. So equity and effectiveness here is a balance, is a trade-off. You can't really have both. So one more dimension of quality that I mentioned that's increasingly important is sustainability. And sustainability, with the current climate change debates, we know that it would be increasingly important. But actually, prior studies there have been very few qualifying health services, but it is a huge impact. I think in my introduction talk, there was a rough figure that in the United States, health services accounts for about 8 to 9% of all the carbon that's generated. So that's quite significant. There are some pioneering studies that have started to look at the impact of health services on carbon footprint. For example, so having primary angioplasty centers has increased carbon emissions by 3 to 0.24 times compared to if you had thrombolysis in the past, where you can just go to your local center. So we've increased effectiveness and a trade-off for sustainability. But mobile breast screening has decreased less car use and less carbon footprint. So I think increasingly it will become more important to balance our high quality services, but also making sure that it's environmentally sustainable. Okay, so rapid overview of what the dimensions of quality is. The next bit is, how should we, so we know the dimensions of quality, but how do we manage it? Because this is what we're all about. Well, essentially, there are 3 stages we need to know in order to study our health services. So 3 stages of managing high quality. First of all, we have to define what good quality care is. So we select our dimensions. We need to understand what it is, what we mean, define it. And then I'll go more into that. And then we start to assess it. So look at it and study it, which is what our research is mostly all about. What aspects of it, dimensions of it, all of it. And then we look at how do we improve it. Okay. So defining good quality. First of all, we have to select a topic. We can't look at everything at once. So we select usually either clinical guidelines or an area of service. We select a topic. We define what this good quality is afterwards. By establishing a criteria, essentially it's a statement of what good is. And so we know about guidelines. So we know lots of different places have guidelines. And so we have a statement of what we think a good quality service is. And then we set a standard. A standard is the extent of which our service or our clinical guidelines should adhere to, the percentage that everyone should be doing it, essentially. A proportion of people should be doing it to having it. This is what good looks like. So everyone should have everyone, how many people should be at a PCI center by what time, would be the standard. How people should be sent to a primary angioplasty for their heart attacks would be the criteria. And if we say 70% is good, would be the standard. And then afterwards, we can do the quality assessment, which is measuring it. So we measure how many people actually get there, EMS services, how much time it takes to get the patient to the hospital. And then we do the quality improvement. So we say, we measured it, and we say, actually, only less people or more people than expected that we set the standard to have reached it. So we want 70% of all of our patients reaching hospitals within 90 minutes, but actually only 60% did. So then we set an intervention to improve it. More cars needed, ambulances needed, maybe more the paramedics need to be trained, something along how you improve it. And then you go back and set the standard again. So it's an iterative cycle. So this is called the quality improvement cycle. Many places use this. So essentially, you can see defining good quality, assessing quality, and improving quality.